Mirabelle is 8 years old. She has cerebral palsy, and this is her second summer doing conductive education in Colorado, and we love it.
Naomi is 12, and she has a couple of rare brain malformations. My son Laz is 15, and he has dystonia and cerebral palsy.
Jeremiah was born by emergency C-section, was diagnosed very early on with cerebral palsy and epilepsy, and so we began our journey very early.
So Maggie had bilateral interuterine strokes, so she's quad CP now with epilepsy.
So Nao and Laz have done all of the traditional therapies.
We have tried every therapy possible.
We've done swim therapy,
Physical, occupational, speech.
Hearing rehab, specialized speech.
ABA therapy,
Passive type therapies like anapanyal.
hippotherapy, horseback riding.
MNRI therapy.
And certainly something of a revolving door of therapists.
I feel like we've done it all and do it all.
When we came to CFCE, we were very excited because on the very first day, they took one look at her and kind of moved her in different positions and were able to make her sit up on her own on the very first day. They were able to kind of tailor the therapy directly to what she needed, and it was something different than we'd seen anywhere else.
Conductive ed has been, in a lot of ways, I think it has drawn other therapies together for our kids. I think especially the group aspect, the social aspect, especially as they're getting older, it's not so easy to motivate with stickers and candy, but motivating with a little competition and having some friends around who are also working on the same things, I think has been really, really important.
For Maribel in particular, socialization has been an issue for her. Kids her own age are obviously more mobile and we're be running all over the playground, and so she kind of get left behind. So what's been great about here is that over the last 2 summers, seeing how much more social she's becoming.
The group aspect allows them to see that they're not the only ones struggling with what they're trying to do.
This is the one area where she has peers her own age or with similar abilities, and what I really love about conductive ed is that the kids, I think, support each other too, and they kind of teach each other.
Even though they started therapy at 6 and 7, and conductive ed even a little later than that, they've really been able to grow and blossom, and Laz has moved entirely from one CP class to another.
We're seeing some really encouraging, fun things. Being able to get in and out of the car by himself and doing that safely. I feel like we're making great progress at him not just doing something halfway and then being stuck, but that he's thinking things through.
Her grasp has come so far, even in the last year, where she can hold a marker or a paintbrush and actually participate in crafts.
Last summer, when we did a conductive ed intensive, he was able to, in the course of just a few weeks of an intensive here, stand independently from the floor, which he'd never done before, and walk independently most of the way down a hallway, both of which were skills he'd never mastered before. And I think the two were really kind of tied together because the way the conductive ed therapists approached his balance issues to address the standing piece, the independent standing piece, then led really beautifully into the independent walking.
The idea of encouraging her to use her own body is really novel. I think that her doctors, and this is their job, is to provide her with the support that she needs, whether it's canes or crutches or orthotics. But what I like about it when we come here is that they want her to use her own body more, so she can build those muscles. And again, it's always a compliment to what the doctors and physical therapists are doing outside of here.
I love how they see each kid individually and they connect with them in the way that the child needs to connect.
I've also really appreciated as a parent having the conductors as sounding boards. It's so amazing how knowledgeable they are and how helpful they are.
The fact that they work so hard to get the Medicaid on board with this kind of program it's huge. It's huge, and this is her main therapy now. We depend on it.
CFCE has been a huge factor in us because it gives us hope. It gives us hope that we're going to be able to maximize what she can do. With Maggie's situation, we don't know what the long-term benefits are going to possibly be, what outcome we're going to have. But we know that when we're with CFCE, we know that we're giving her absolute best chance at maximizing what her potential is, and giving her a happy life and maximizing her, because Maggie wants to be stronger, and you can tell that she wants to be better at things, and we know that whenever she's here, she's getting that attention to help her get there.
The thing that I take the most pleasure in is her desire
Yeah.
to be independent. You know, you kind of need that first, and she's never had that as much as she does when she comes here.
Yeah.
Any parents that go in this situation, they take their kids to where they're sent to, physical therapy, occupational therapy, things like that, and they're saying, hey, for a person in this box, in this category, this is the type of therapy that we should provide. And that doesn't necessarily work for everybody, and it didn't work for Maggie. You know, Maggie gets irritated, Maggie gets upset, and that's really hard on a lot of kids. And so it was really great when we brought her to CFCE, because they looked at her and said, hey, this is probably the approach that's specific to her, not to anybody else. And Maggie has reacted well to it and has flourished in it, and we know that when she's here, she's getting the best possible therapy that she can get.